should have me in it. Like this. If you do need to sit though for any reason, because you won't be standing for a while. Okay. So we will start off just kind of talking about the hip today. We have the hip split up into 3 parts: the pubis, which is kind of the pubic area. You have the ilium, which is like this up here. It's the disc part, and then you have the ischium, which is down here, and kind of back lower. So with that, there are just 3 bones all attached together. Some joints that are good to know are the coxifemoral, which is right here. It attaches the femur and the head of the femur to the acetabulum. It's just that socket, ball and socket joint. And then you have up here, coming across, let's feel it, yeah, right there. You have the sacroiliac joint, and that just attaches the ilium to the sacrum. Yeah, it's just it's a small, free-moving joint that really on the outside doesn't look like a joint at all. Not like some of the ones that we've had before, but yeah, it still is. So outside of that, we'll go into the different landmarks. First, I'll start with the bursa. So you have the trochanteric bursa, and that's going to sit on the greater trochanter of the femur. So that's going to be right there. That's the greater trochanter. The lesser trochanter is going to be on the inside, kind of posterior, right on the inside of the butt there. Then next we're going to have the ischial gluteal bursa, which if you lift that, and it's just underneath here. And then you have the iliopsoas bursa, which is going to be like right there. And it's going to sit just anteriorly in the front. So next we'll move on to the ilium, or we'll start just with the simple ones. Pubis, just the pubic bone there. Then if you move on to the ischium, again, right on the butt there, where that bursa is the ischial tuberosity. And then outside of that, on the ilium, you're going to have the iliac crest, and that's just going to be this that goes, and it's kind of goes all the way around. And then you're going to have on the front here, so if you bring your leg down, please, you're going to have right up on the top here, the anterior superior iliac crest. And then you're going to have down here, at this bump, the anterior inferior iliac crest. On the back side, if you move down, right there, you have the anterior, or the posterior superior iliac crest. So that is it. Oh, and then also the iliac fossa, which is the concave disc kind of shape inside of the hip. So that's just going to be like straight ahead that way. So outside of that ends the ilium. And lastly, the femur, which has, as I mentioned, the greater trochanter and lesser trochanter. You're going to have the sciatic nerve that comes down. You're going to have the IT band, or the iliotibial band that comes down. And then you're going to have attached to that, trying to think, oh yeah, pectial line, which is right below the butt, is just kind of higher up. And then you're going to have the intertrochanteric line and ridge that's going to be anterior on your upper aspect, or your proximal aspect of the femur. So now that we've done all the body parts, I'm pretty sure we'll move on to some of those muscles. So we'll start off with the psoas major. And that runs from T12 to L5, that's the origin. And it's going to insert all the way to the lesser trochanter down there. And it is a hip flexor. So it's just going to help with the flexion of the hip. Next, you're going to have the other iliopsoas muscle, which is the iliacus. And the iliacus, so whereas the psoas major kind of runs like this here, the iliacus runs lateral, and it's going to have an origin of the iliac fossa. So sorry, I was a little high here. But yeah, it's going to have the iliac fossa as the origin, and then as the insertion, it's going to go again to that greater trochanter. Did I say? Yeah, I think I got it right on the last one. But yeah, lesser trochanter. They both go lesser trochanter. Sorry about that. So next, after you do those, we'll go to one that we did before, which is the serratorius. So the serratorius is going to run from the anterior superior iliac spine, so up here, down to the pes anserine. And it's the longest muscle. It's one that we did last time. And this one is flexion, abduction, and external rotation. So it does a lot more in the hip than it did previously with the knee. And yeah, that's really all for the serratorius. Another one that you might remember is the rectus femoris. So the rectus femoris, it's superficial to the vastus intermedius, but the vastus intermedius is a knee muscle. It's not for the hip, so we don't have to worry about it. But yeah, so for the rectus femoris, it does help with hip flexion as well, and it's going to originate at the inferior, so the anterior inferior iliac spine, and it's going to go down to the tibial tuberosity. So it's just going to run down, and it kind of goes straight, as you remember, down to the tibial tuberosity. Next, we are going to move to the I'm trying to think where I want to go. I'll just continue down the path of more hip flexors and just do the tensor fasciae latae. That's the last hip flexor. And it is a flexor, abductor, and internal rotator. So unlike the serratorius, it rotates internally versus externally. So with that muscle, it's going to originate on the outer lip of the iliac crest. So it's going to originate outer lip, and it's going to go to the greater trochanter and the IT band and Gerdy's tubercle. So it's just going to go along there. That's really it for that. It's just right here. And next, we'll move to some of the ones that we had before, which were the semimembranous and the semitendinous. So we'll start with the semitendinous. That, if you remember, it starts at the ischial tuberosity, and it's going to run down. So it's going to be kind of right in the middle, sandwiched between that rectus femoris the biceps femoris, sorry, and the semimembranous. And with that, it will go from the ischial tuberosity down to the pes anserine, so kind of wrap around, whereas the semimembranous will go from that same ischial tuberosity down to the tibial, or not tibial tuberosity. It will go down to the medial tibial condyle. So yeah, it'll just go down, and it's going to be, as I said, medial. You can kind of think the semimembranous, so it's M for medial. And then, as I mentioned, the bicep femoris is right here, and it is going to go, it has two heads, so it has the short head and the long head, and those heads are going to go from the ischial tuberosity and the the linea aspera, and they are going to go and move down to the lateral aspect of that condyle. And with those, they just, all three of those muscles allow for extension of the hip. So they all have the same purpose. Outside of that, we'll move on to hip adductors, sorry. So for hip adductors, they're in the front here. You're going to have the adductor brevis. Adductor brevis. And with that, it's going to run from the pubic bone over to the proximal 1/3 of the linea aspera. You're going to have the adductor longus, which runs from the same pubic bone down to the middle 1/3 of the linea aspera, and then you're going to have the last, which is the adductor magnus, and that's going to run from the ischial tuberosity and the same pubic bone, and it will go down to the lower 1/3 of that same the same linea aspera, as well as connect to that tibial, the lateral condyle of the tibia. Sorry. And so yeah, that ends those muscles. You're going to have the gracialis, which runs down. It will again connect at the pubis, and it will move all the way to that pes anserine that we mentioned before down here by the knee. And that, again, it's adduction. The last adductor is the pectineus, which runs inside. It's the pubic bone again, and it goes to the pectial line. So yeah, that ends the adductors. Next we will go to an external rotator, which is the piriformis. That's going to be on the back too. The piriformis is going to run to the greater trochanter, and it's going to do that. Piriformis, greater trochanter. I'll come back to that, because I have to remember. I had a brain cramp. And next, we'll just do so we have the glutes. Those are the last ones that we have other than the piriformis, which I'm hoping my brain fart will go away. But yeah, so the glutes are going to be the maximus, which is the chunk of butt. You're going to have the minimus, which kind of is right here. And then you're going to have the medius, which is a little bit more superior to all the rest of the muscles there. So with that, we'll start with the maximus, because that's a little bit more complicated. It attaches, or it originates at the sacrum coccyx, the ischial gluteal line, and then it originates at the gluteal line of the femur. So that one is just a little bit more complicated, and it causes external rotation and extension. The other glutes are a little bit different, with the medius and the minimus both inserting at the greater trochanter. They have different, slightly different origins though, with the medius being at in between the iliac crest and the posterior and anterior gluteal line of the ilium. And so it's just between there, whereas the minimus is going to have right on that anterior gluteal and posterior gluteal lines. So after that, really have the motions that they do. Minimus is abduction, while the medius is abduction and internal rotation. So that ends all of those. I think that should be it. Yeah.